Did you know that between 25 and 33% of children with ADHD have a coexisting anxiety disorder? In fact, childhood anxiety is the second most common condition co-occurring with ADHD. Well, we know a multimodal approach to ADHD treatment is key, and it's even more important when children and teens have both ADHD and anxiety. Today, I'm speaking with Dr. Norrine Russell, and we're going to discuss what it looks like when students have both ADHD and anxiety and how to support them. Dr. Russell is the founder of Russell Coaching for Students. She uses innovative methods for coaching complex students, including those who are 2E, have ADHD, autism, anxiety, and those with learning differences. She has 20 years of experience creating positive youth development and parenting education programs, and she's here with us today. Thank you for joining our conversation. Let's jump in.
Millions of kids struggle with learning, processing, and social emotional difficulties. These challenges interfere with their ability to reach their full potential. Dr. Karen Wilson is here to help. Her extensive background in pediatric neuropsychology and higher education have prepared her for this unique mission. Listen as she delivers content to inform, educate, and empower parents and educators. This will enable you to identify challenges that kids face and get them on the road to achieving their full potential. This is Diverse Thinking, Different Learning by Child Nexus.
Dr. Russell, thanks so much for being here.
I'm thrilled to be here. Thanks for having me.
It's so nice to meet you. We actually haven't seen each other face to face, although I'm very familiar with your work.
Exciting to be here. I think I've taken a look at your podcast and listened to a couple of them, and they're just tremendously interesting and valuable to the parents that I work with, for sure.
Yes, and that's why I wanted to have you on, because you provide such valuable information and support to many of the families who are very much like the families that we see in my practice and that my colleagues see in Child Nexus community. And everyone is saying that now is a really busy time for professionals because the honeymoon period for starting the academic year is over. And so if you're seeing challenges, they're going to begin to emerge right around now.
No, it's true. Things are definitely ramping up. I mean, we're usually really busy at the beginning of the year with parents who want to get their kids set up with coaching, and we're big advocates of prevention and early intervention and get things set up correctly from the beginning. But this is definitely sort of a high anxiety time, for kids who are on quarters. Those first quarter grades have come out or are coming out, and parents are starting to think like, wait a second, we're still dealing with missing assignments and it's almost the end of October. And wait a second, like I'm still not seeing any change in like their study habits, even though they've promised me they're working harder. This is a high stress time of year, and I'm not sure it gets any better really until we get through finals. Yeah, the honeymoon is over.
It really is. And it's interesting because many students, like you're saying, start off the year like things are different. They're getting their assignments turned in initially, and because the load and the expectations aren't as high yet. And then the expectations increase, the academic demands increase, and that's where the difficulties start to arise. So we're seeing that as well. Like you said, we've had a number of conversations on the podcast. Many have been around ADHD. Most recently, we talked to Dr. Stephen Hinshaw about girls and ADHD and Dr. Syed Naqvi about how medication can help students with ADHD. And one of the things that keeps coming up is anxiety and comorbidity of anxiety. And, for our listeners, comorbidity is when you have two co-occurring disorders or more than two, or problems in the same person at the same time. And my colleagues and I are seeing a lot of co-occurring anxiety with ADHD. Have you seen that as well? I know you mentioned anxiety when we started talking about what things are looking like for kids at this stage.
Yeah, we definitely do. And in our practice, our niche is really those complex kids, who have more than one diagnosis. So they have ADHD and anxiety, or they have ADHD and autism, or they have autism and anxiety, so any combination of the mood disorders, the developmental disorders, and some of the learning disorders. And so, Yeah, I think that I wish now that I had a really clear sense of how much anxiety we were seeing before the pandemic versus now. But definitely for sure, like everyone else, seeing more kids with anxiety, seeing kids with higher anxiety. Let's not forget the third component of this, seeing students whose parents are a lot more anxious and much anxious about their own stuff as adults, but also much more anxious about their students' things. So I had a coach text me this morning and say, I want to find 5 or 10 minutes to talk with you today. My student told me yesterday in her session that the thing that stresses her out the most is that her mom is so stressed out about and I said, yeah, let's figure out what we can do to reassure that mom a little bit, and also to normalize some of the struggles of middle school and high school, and hopefully allow that mom to, keep that anxiety on her side of the table.
Absolutely. And that's why, when parents bring their child in, their adolescent in for an assessment or for an evaluation, and we find ADHD or anxiety, it's often not about just identifying and treating the child. It's about supporting the entire family. Because like you said, oftentimes if a child is anxious, there's also some anxiety in the family. We know that anxiety and ADHD run in families. And so it's not atypical to also see a parent struggling with many of the same issues, although it looks very different in an adult and a fully developed brain than it does in a child or a teen.
It does. But you can feel it there just as strongly. We spend a lot of time at my practice doing parent team meetings with the coach, myself, and one or both parents. And most of the time it's really about the anxiety and the worry and the concern that the parent has about, are they doing a good job? Is their student doing a good enough job? Yes. But what should they be doing, and their worries and their concerns? And I think, we live in a time when parents are expected to be pretty all in on parenting. It's hard to say, I'm going to step back here. I'm going to let my teen handle this. I am okay with the consequences of that, because the way the cultural shift has happened with parenting in the last generation, I think the reigning idea is, as a parent, you can get your kid to do anything if you just push them hard enough and nag them enough and sign them up for enough accelerated classes. And that's not always the case. And so sometimes I think parents need, a sounding board to also say, your child's going to unfold at the pace they're going to unfold. And it's okay. It's okay. You're doing a great job. You really are doing a great job. And the most important thing is that you stay connected. The most important thing is how many AP classes they have, or what their GPA is, or what their standing is in school. The most important thing is the connection between, the tween or teen and the parent.
Absolutely. And I think the societal expectations contribute to a lot of the anxiety that we're seeing. And we know that anxiety is excessive. It's, a fear that can be triggered by a number of different things in the environment. It can be triggered by just simply going to school, by seeing how well other students are doing, by looking at how easy it is for other students to learn. And oftentimes, the triggers for parents can be other parents who come to you, as you're doing drop off and saying, oh, my kid made the honor roll, and then you can be flooded with that stress or that anxiety about, should I be doing something different? Or I didn't even know that there was an honor roll, and that was something that was revealed recently,
Yeah. No, it's very hard to balance, because the downside of some of what's happening at schools these days is that we are on information overload as parents. The minute a quiz has been missed, the minute a homework assignment has been graded. And I think that kind of nonstop detail level information is is actually not helpful for parents at all. I always encourage parents, turn off the portal messages. Like if you want to see what's going on, you take charge of it. Go in there once a week, but do not have your phone on to be dinging in the middle of your yoga session or your appointment with the doctor or your work at the firm, interrupted with, well, Matilda didn't turn in her 10-point homework assignment this morning. You know what? Like, Matilda's going to have to figure that out.
Right. And she will. She may need some support, but she absolutely will figure it out. And, anxiety is just something that adds to the difficulties that many students with anxiety face. And one of the things I often describe to parents is anxiety, what it does is it kind of hijacks that prefrontal cortex, and it floods the brain so that students can't access their thinking. They can't access that ability to self-regulate, the ability to organize, to plan, to inhibit distractors in their environment. I'd love for you to talk about what anxiety looks like in students with ADHD.
Right. Yeah. Well, just as you're saying, it hijacks that frontal lobe. And so what happens is we see a student who, and this can be for some period of time, who's not in touch with that prefrontal cortex, who's operating all kind of from the emotional point of view, all from the amygdala driven feelings and fears. And when a student with ADHD gets in that space, what I train the coaches is you have to kind of wait for them to come out. You have to work with them on what strategies do they use to calm down? How do they process this information? But it's not something that happens immediately. It's not, like turning a light switch off and on, like, okay, well, I got hijacked by my amygdala there, and now I'm going to turn the light switch back on and start working from my rational prefrontal cortex. No, I mean, for some students, that process can take 30 minutes to an hour to really calm back down and be inside the thinking part of your brain. And I think for parents, when they see that happening, to back off, to back down. I think we forget sometimes as adults the difference between how our brain works, where that prefrontal cortex is dominant, and how a teenager's brain works, where it's really the amygdala and the more primitive parts of the brain. And so it's like talking two different languages at times, and then of course, we always think, well, they can do it. I've seen them do it before. Like, I know they can be rational. Well, when they are not tired, not hungry, not stressed, not worried about relationships and social and emotional pressures, yeah, for sure they can. But we just have to be more cognizant of what gets in the way of that, rational thinking that we start to come to expect from high schoolers.
Absolutely. And those triggers, like I said, that there are triggers to that anxiety. You beautifully said that for some students in some situations, they can absolutely access that frontal lobe and calmly do what it is that they need to do. But there can be a trigger that can elicit that anxiety, and then they can't do something that they were able to do the week before.
Mm-hmm. Well, and something else that we see a lot is the student is able, because they feel a tremendous sense of pressure and maybe they're high achieving. And so they stuff that anxiety down or they ignore it, but it ends up coming out in some way or another, generally, I think physically in terms of exhaustion or illness, and even sometimes socially, by withdrawing from friends or not really having the energy to participate in as many things at school as they had in the past. And so even when we see a child or a teen who seemingly is coping with this stress, I think it's important to take a look underneath and see, well, are there secret places that stress is hiding in that student? How is it that this affects them? Because we all know there are a lot of people with both anxiety and depression who are very high functioning, but whose moods and mood disorders are really eating them up inside.
Yes. And it's also important to be able to identify, is this just ADHD? Is this just anxiety, or is this both? I had a parent reach out to me this week and say, my daughter is in college now and she can't focus, and she was never identified with ADHD and she has a history of anxiety. So now the question is this anxiety? Because anxiety can impact your ability to focus and to get things done. And the question was, could this be a missed ADHD or is it anxiety? And which is why it's important to have a good understanding, because the treatment for ADHD alone or anxiety alone or ADHD and anxiety in the same person are going to be very different in terms of the approach.
Yes. Yes. Well, and I think it's helpful for parents to know that, only about a third of kids with ADHD will only have ADHD, And so as a parent, the minute that starts getting discussed, either from school or your pediatrician or a psychologist, or you have the evaluation, you need to just start thinking, okay, well, what else might be going on here that I be attuned to? And of course, a competent psychologist, a licensed psychologist will have been looking at that as well and taking that into account with testing. But I think it's just important for parents to understand that very few children actually just have ADHD. And the ADHD anxiety combination is particularly difficult to figure out which is primary and which is secondary. Where do you start with treatment? Does it seem like the anxiety is primary and is thus creating school problems and problems focusing? And so then we really need to start with the anxiety piece of the puzzle, or is the ADHD causing anxiety because the ability to regulate focus and to get started on tasks and finish tasks is creating anxiety? It's a tough puzzle. Yeah.
It really is. And, I actually really enjoy working with those complex kids, because you really get to have a better understanding of kind of which came first, how are they interacting with each other to make things more difficult for kids. And then it helps you to define and identify what kinds of treatments and what kinds of interventions will work. And, a multimodal approach to treatment is so important for these kids who are struggling on multiple fronts, 2 or more, anxiety and ADHD, or sometimes it's anxiety, depression, and ADHD.
Right. Well, and ADHD alone calls for a multimodal approach.
Absolutely.
If we have layered in anxiety, depression, dyslexia, any other kind of psychiatric or developmental label, for sure we need multimodal therapy. And I'm not sure that message is getting out as clearly as it needs to be. I wish that everyone who sort of touched the lives of parents with ADHD were really hammering that message home, that multimodal therapy is what's going to be most effective. Medication is first line treatment. You need parent education and support. You need a school plan. And then you need to figure out a way for that child to have individual level support, whether it's skills training or therapy in the case of anxiety and depression. But I don't know what. Yeah, I just don't feel like we really have hammered that message enough.
Yeah. And it's an important message to get out there, which is why I'm so glad we're talking about this, because when we do have that multimodal approach to treatment, we know the outcomes are better. And we know that there's, like you discussed, synergy between treatments, between medication management and skills training. And it's not one or the other. I had Dr. Syed Naqvi, who's a psychiatrist, on the program, and he was saying that, medication is not a magic potion. A lot of parents think that everything is going to go away. It's going to be easier with medication. It is, but it's not going to help kids, students, teens develop the skills in executive functioning, for example. It's going to help them focus and help them be better able to inhibit distractions and to sustain their attention over an extended period of time. But it's not going to teach them to plan and organize and manage their time. That is going to become evident once they have that skills training that you talk about.
Well, and we find sometimes that parents come to coaching because they want to avoid medication, and I often will say to them, the thing is that coaching and learning these skills is going to require the same ability for the brain to be regulated, to fight off distractions, to fight off impulses that school does, that sports does, that, chores at home do. And so, what the American Academy of Pediatrics says is that a combined approach, a multimodal approach is what's best. But we do occasionally run into parents who want to substitute coaching for medication. And I say, it's kind of just like all the different things. My metaphor is always nutrition, like you can't only have protein. You can't only have complex carbohydrates. The whole thing works best if we have the entire plate full of what we need. And so we talk about it pretty frankly at my practice. And I think parents have been very open to that. Certainly providers really like being able to get feedback from us and our coaches on what they're seeing and how well their students are doing. But we occasionally have, pushback from parents who are, well, this is why I brought them to you because they're not on meds. Okay. You just need to understand that without meds, the brain is not going to automatically regulate the focus. And so it's going to take a little bit longer and possibly a lot longer to learn these skills, just like it's taking them a lot longer to be successful in school.
Right. And I think that sometimes the delay in medication, and I'm not saying that medication is appropriate for everyone, but when medication is needed and there's a delay in starting medication, it can also contribute to some of that anxiety because there's a lot of frustration. There's a lot of academic failure. Like you said, there's forgetting assignments. There's, not finishing the work on time. And that can create, like I said, a great deal of frustration, can contribute to anxiety. And so that's something to think about as well.
Well, and we know that what happens to those students who they start out conscientious, they want to do a good job. They don't walk into kindergarten thinking this is going to be, the worst experience of my life. But, if year after year, it's the ADHD is not identified, and then maybe it is identified, but it's not treated, that's a lot of negative messages for a person to hear. I don't know about you, but I don't like hearing one negative message in my day. If I have one parent who's concerned about something, or, my husband's, worried about one thing or upset about one thing, I don't like that. But you think about our kids with ADHD, they're getting constant negative feedback. And it doesn't feel good, and it does take its toll. And that's why by the time we take a look at what happens to untreated kids, by the time they get to their teens, they're often engaging in high levels of risky behavior and drug and alcohol use because, of course, they want to escape that. I'd want to escape it also.
Right. And that's really interesting that you mentioned that, because so many parents come in thinking that if I put my child on medication, they're going to abuse substances. It's going to be their gateway drug, when in fact the research suggests the opposite, like you were saying.
Yeah, the research suggests the opposite, that actually by using medication properly, that you actually are going to lessen the risk of these high risk behaviors, even including things like accidents, driving problems, even social and emotional things, dating choices, sexuality, behaviors. So there's, of course, all parents worry a little bit about, oh, they're not eating lunch, or, well, I just don't like medication. But when you look at the overall picture of what medication does for a child with ADHD, the research is really clear. People often ask me, well, what are your feelings about medication? And I said, I have no feelings about medication. I
can tell you what the research says.
Right. So I don't have any feelings about it whatsoever. I can tell you that, the research is clear. I can tell you what the medical associations say. But, the only feelings I might have about it are, as the mother of two children who have various diagnoses, sometimes I feel happy when I know that they are on the right medication, but that's the only place my feelings play on it.
Absolutely. I think well-informed parents make good decisions. And it's about presenting them with all the information, all the options that they have, and helping them to make the right decisions. It's just that I think there's a lot of misinformation out there, which is one of the reasons why I wanted to do this podcast, to give parents, reliable information, evidence-based information, so that they can make informed decisions when deciding on the treatment for their kids. Now, when you see students who have both anxiety and ADHD, what kinds of supports do you see as being helpful for them?
Right. So I think as we're working with students like that, generally speaking, what we're trying to establish is a strong coaching relationship so that the parent can back off the school reminders and the school prompting and the school anxiety. And that's really pretty important, because once you get rid of all that conflict between the parent and the teen or the tween around school, that alleviates a lot of anxiety. So that's one piece of the puzzle. A second piece is that we very much work as a team, not just with parents, but with therapists and psychiatrists. And so once we have a release of information, might be likely to reach out to the therapist and say, what coping mechanisms are you working on, and how would you suggest that we adapt those within the coaching session, so that if the student is really getting worked up and wound up about huge paper they have to do or huge exams at the end of the semester, that we can help them integrate what they're learning in therapy with what we're doing in coaching. And I think that's valuable. And then, just contributing to sort of the students' self-awareness of what their feelings are at any given time and what's getting in the way of practicing good executive functioning so that they can get their work done. Like, why didn't this happen? And not just why didn't it happen because you have ADHD, but was there something else going on? How were you feeling in the moment? What self-talk did you try? What strategies did you try to get started when, you were unable to? And kind of bringing in that social and emotional component to understanding the motivation and the accomplishments of students.
And what you've described is a multimodal approach, right? And that's what we find to be effective. You talked about making sure they're getting the psychotherapeutic, whether that's psychotherapy and medication or psychotherapy alone. In some cases, they're getting the coaching, the academic coaching, executive functioning coaching that's needed for so many of our students who have ADHD and are struggling with those executive functioning skills, the delay in the development of those skills, the dysregulation, and the self-awareness. That metacognition is such an important piece of the executive functioning puzzle, and that understanding of what they're experiencing. With the little ones, oftentimes it's hard for them to even identify anxiety and put a label on it and know what that is. But with older kids, you can give it a name, and, therapists often say you name it to tame it. And they can recognize when they're experiencing worry, when the worry is excessive, and then they can, employ those coping strategies. They can understand the link between their disorganization and the difficult time they've had completing assignments. And so helping them make all those connections is so important. And it seems like the combination of coaching with psychotherapy, with medication when it's warranted, is really essential. And then that missing piece that you discussed earlier is really making sure the parents have the support that they need so that their stress and their anxiety is not impacting their teen.
Oh, I think that is a huge component these days, because the message parents are getting from these school portals is, I'm telling you that your student has missed something, and the parents are hearing that as, and so you are now responsible for making sure that gets in, And I have said to countless parents, look, they can tell you all they want. What they're doing is making sure you're informed. It's not a call to action for you to make sure that that homework gets done or that test gets studied for. All they're doing is informing you, but I think that's awfully hard for parents who are conscientious and care about their kids' education to not see it as some kind of mandate to take action. But our philosophy is that the mandate is to the student. And if they need support getting their work done, then let's get them support, especially in middle school and high school, that's not mom or dad.
Yes. Yes. And we don't want parents to feel that their child's difficulty is because of something they are not doing, because that's absolutely not the case. We talk about anxiety, we talk about ADHD, it's neurodevelopmental. There are things going on internally within that child's brain and the wiring of that child's brain that causes them to respond the way they do and to behave in the manner that they do. Of course, there are environmental triggers and things that can contribute to how ADHD looks in various settings, but it's not the parent's fault.
It's not the parent's fault, and it's not the student's fault either.
It's not.
We had one of our earliest psychiatrists for our kids said, "It's not your fault, but it is your problem." I'm sorry. You know what? That is a great phrase. It is not your fault, but it is your problem. I'm sorry. And that is, the bottom line of it is, no, it's not your fault. You don't need to feel bad. You don't need to feel ashamed. You don't need to take on any stigma, but you are responsible for figuring out, both either as the parent or the student, how do you handle this? What are you going to do with this? The same way you would with any other challenge.
Absolutely. Absolutely. And, one of the things you said initially is that students inherently want to succeed. They want to do well. And parents similarly want their children to succeed and have success in their endeavors. And success can look different for different kids and for different families. But like you're saying, the combination of therapy, medication when warranted, executive functioning, academic coaching, is really essential and plays a significant role in improving outcomes for so many of the students that we work with, particularly those with ADHD plus another mood disorder or anxiety.
Yeah. Well, and I think it's just important to say that each person on the team has a role, right? It's not our role to diagnose or treat the mental health piece of it. And at the same time, therapists are usually willing, but not that experienced at the executive functioning side of things, And so it really is important, I think, as a parent or as a professional in the community to know, when do I need to be referring for mental health and when do I need to be referring for executive functioning? And, there are kids in our practice who see both a therapist and their academic coach on a weekly basis. And I think that's just fine. That's what that student needs at this moment in time. But I think having a little more clarity about what each person's role is can be helpful, and having some clarity around what school can and cannot do. Schools, especially private schools, I think are anxious to reassure parents, like, we'll work with your student, we can provide this. But there is a difference between getting, 30 minutes in a group setting at school versus an hour individually with, someone who is really incredibly well trained when it comes to ADHD, autism, anxiety, and executive functioning. So it's just, I always urge people, look at who's on the team and what's missing on the team, and let's make sure we know what each person's role is.
And everybody is working together to help that particular child, that teen.
Yes.
And that is important because you're communicating with each other with the same goal.
Right. But as you know, often there isn't communication.
Yes.
So I think that part's really hard. We make a big effort to get releases from our families for everyone on the team right at the beginning so that we're not having to track that down later. But I think it's hard these days to have time to truly collaborate, and everyone kind of stays in their own lane and, does their part of things. But it's so much better for the student when we can put our heads together. I know the psychiatrists are always thrilled to hear from us and get, our perceptions of what we're seeing on a weekly basis, because otherwise, they're seeing that student every 3 months and they're asking, well, how is school going and how are things at home? But the kind of hard data we can provide about our grades going up, our grades going down, is the number of missing assignments going up, going down? Is absenteeism going up, going down? How does the attitude towards school seem to be? How's the ability to focus during session at 7 p.m., and they just love getting that kind of hard data.
And that information is so helpful when you're thinking about refining the treatment plan and, having documentation as to what is working, what is not working, what you need to double down on, and where a teen might need a little more support.
Yeah, absolutely.
Dr. Russell, thank you so much for being here and sharing your expertise with our listeners. If students or their parents want to know more about your executive functioning coaching, your academic coaching, where can they go to get more information about this really important intervention?
Sure. We're easy to find. And we do offer coaching services across the United States and Canada. So people sometimes see our website and see that the headquarters are in Tampa, Florida, and think that we are just in Tampa or just in Florida. But our students are across the country. Our coaches are across the country, and we work remotely, and we have a really strong and effective model. So if you'd like some information about what we do and how we do it and whether or not it might help your complex child, our website is russellcoaching.com, and that's 2 S's and 2 L's, russellcoaching.com. You can just Google my name, Norrine Russell, and the practice page will come up. We have an Instagram that's at Russell Coaching LLC. We're on LinkedIn, all the usual social media, but probably the easiest thing is to go to the website. And if you're someone who hates websites, just call our office. The number is 212-716-1161. And Carla will answer the phone and she'd be happy to answer any questions you might have.
Wonderful. Thank you so much. I'll be sure to put links to all of your contact information in the show notes. It has been such a pleasure. Thank you so much for coming and speaking with me today.
Oh, thank you for inviting me. I love the conversation. It's great.
We know that a child diagnosed with ADHD benefits most when there is a partnership between their families, treatment team, and their teachers, and when parents are equipped with the knowledge and have the skills to support them. This is one of the reasons why I'm so excited about the parent learning groups we will be next starting in January of 2023. On Tuesdays at 5 p.m. Pacific, we will have groups for parents of children and teens with anxiety. And on Thursdays, we'll be offering groups for parents of children and teens with ADHD at the same time. If your teen or child has both anxiety and ADHD, we will enroll you in both groups for only one fee. All you have to do is email me, let me know you're interested in one or both of these groups, and I will let you know when registration opens. You can email me at drkiwilson@childnexus.com. Thank you so much for listening, and I'll see you next time.
Thanks for listening to Diverse Thinking, Different Learning by Child Nexus. For more resources, visit us online at childnexus.com.